Module 2, Requirements to become a transplant candidate. To begin this module, we are going to dive into what I call the big no-nos for kidney transplant. If you have any of these conditions, you will not be able to get a transplant. These conditions include severe cancer, serious health conditions that are not helped by transplant, such as severe lung, heart, or liver disease, bad infections, AIDS, poorly controlled kidney failure. This means you are not taking care of yourself or your kidneys. Maybe you're not showing up to dialysis, you have too much fluid weight gain, or you're not eating the right foods or taking your medications, which can lead to high blood potassium, phosphorus, or PTH levels. If you cannot tolerate anti-rejection medications, you cannot get a transplant. If you have severe obesity, which is a BMI greater than 37, you also cannot get a transplant. BMI stands for Body Mass Index, and it is a calculation that divides your weight by your height to determine whether or not you are overweight relative to your size. If your BMI is greater than 37, you must lose weight before you can be a candidate. If it is known that your kidney disease will not go away after transplantation, leading to early graft failure, which is just another way of saying your kidney stops working, you can't get a transplant. If you have lack of or limited health insurance, or if you cannot find transportation to the Portland Clinic after your transplant for follow-up, you will also be unable to get a transplant. Although these conditions do not mean you cannot get a transplant, they might make the process a little more difficult. These problems include poor circulation, stroke, diabetes. In order to get a transplant, it must be controlled, meaning your A1C or the amount of glucose in your bloodstream must be less than 8. If you use tobacco or marijuana, you must quit. Active stomach ulcers, prior cancer. In order to get a transplant, it's important that you're cancer-free for at least 2 years, sometimes even more. And moderate obesity, which means you have a BMI greater than 35. All of those might affect your ability to get a transplant. Since there are many factors that can make getting a transplant difficult, we have to make sure you are healthy enough to get a transplant. Therefore, there is an evaluation process that must occur before you can be listed as a candidate. This process includes a lot of medical tests and screenings. These tests require a lot of planning and effort too, but they are all important to make sure that doctors know as much as they can about your physical, mental, and emotional health. It is also important for you to be aware of your health and to make an informed decision based on your qualifications to be a candidate. Some of these tests can be scheduled with your primary care doctor or other specialty doctors, and some of the tests will be arranged for you when you have your Visit 1 appointment with your coordinator. The list of tests that I will explain next is very overwhelming, but it is likely that you won't have to complete all of them. However, understanding what might be required of you in the near future is important. The first tests I will cover are ones that you can schedule through either your primary care doctor, dentist, or gynecologist. A gynecologist is a doctor that works with the female reproductive organs. There is a pelvic exam and pap smear required for all women. This will test for cervical cancer. It takes about 10 to 12 minutes, and a plastic tool called a speculum will be placed into your vagina to get a sample of cells that are tested for cancer. A mammogram for women over 40 years old must be done once per year, and it will check for breast cancer using X-ray pictures. A PSA is a blood test for prostate cancer, which is required for men over 50 years old. It also must be done once per year. A colonoscopy is for men and women over 50 years old. It lasts about 30 to 60 minutes, and a tube will be inserted into the lining of your colon to look for any problems. If there is anything that seems wrong, small amounts of tissue can be removed and examined for disease. This is called a biopsy. There is also a dental clearance and evaluation that must be completed. A cleaning must have been done within the last 6 months, and your dentist will need to sign a form saying that your teeth are healthy. You can start working on these tests now if you haven't gotten them in a while, or just call your doctors to see which tests are up to date. These next tests are all checking your heart, and they are arranged for you at your Visit 1 appointment with your coordinator. First off, there is an EKG or electrocardiogram. During this test, sticky electrode patches will be attached to your chest, and you will lie flat while a computer creates a graph of the electrical impulses that move through your heart. Then there is an echocardiogram, ultrasound. It will see how your heart functions and see if you have any heart disease. It's like taking a very fancy X-ray image of your heart, even though you are not exposed to radiation. There is a nuclear cardiac stress test. This will see if there is a risk for heart attack and show if there is not enough blood flowing into the heart. It also uses sticky electrode patches. Lastly, there is a cardiac catheterization for patients older than 65 years old, patients with diabetes as the cause of kidney failure, patients with a history of stroke, heart disease or peripheral vascular disease, or any patient with abnormal heart testing. In this procedure, a thin tube called a catheter will be placed into a blood vessel right near your heart to examine how your heart is working. You will be awake during the procedure, but there is very limited or no pain. By now, the testing might seem endless, but this is the last slide, I promise. Other testing may include lung testing, which includes a chest X-ray or CT scan for men and women over 55 years old. The X-ray will produce images of the heart, lung, blood vessels, etc. to make sure you are healthy. There will be a brief radiation exposure. Then there are blood tests. These drawn labs will look for viruses, including hepatitis and HIV, and they will be done while you are at the main transplant program in Portland. There is psychiatry to make sure that you are mentally and emotionally stable for transplant and have a good support system set in place throughout your treatment. There are blood vessel ultrasound imaging, which uses a probe on your skin to show the movement of your organs and blood flow to make sure your circulation is good. And lastly, a bladder ultrasound in urology, which focuses on the urinary tract system and the male reproductive organ. You'll have to have screenings for those to check for drugs or alcohol in your system. It is super important that you stay motivated and on top of getting all of these tests done, preferably before your visit to appointment. That way you can be listed as soon as possible. So, what do I do next? Just like the first module, please fill out the quick survey to check your knowledge. If you still think you want to get a transplant and will fit the requirements, try to schedule a time to sit down with your nephrologist. He or she can make a referral to the transplant center if you haven't gotten one already. If you are waiting until your first visit to the main transplant program, keep educating yourself as much as possible. If you think you will need to complete any of the testing mentioned in the previous slide, it never hurts to get a head start as well. Remember, it is perfectly normal to feel overwhelmed, scared, worried, or uncertain. Make sure that you are writing down questions when you think of them, and focus on your feelings as you make this big life-changing decision. Go online to learn more about kidney disease and transplant, watch videos from patients who have been through the process, and reach out to professionals with any concerns. Don't be afraid to ask for help when you need it, and don't be afraid to use your brain power to read up on transplantation. You've got this.